A new £1.2 million facility to give medical-grade heroin to the city's most problematic drug users is ready to open. The Enhanced Drug Treatment Service will treat the most at-risk heroin users who are in danger of a fatal overdose, HIV and Hepatitis C. The facility is located to the east of the city centre in an area where already there is a serious problem with outdoor drug injecting. It is expected that it will treat 20 patients in the first year and then doubling the number to 40 in year 2. The centre is a first in Scotland but is commonplace in many other European cities. The Evening Times has had a look around the centre before it opens sometime in the next few weeks. Dr. Saket PriyardashiREAD MORE, medical-grade heroin drug treatment centre to open in Glasgow. The EDT centre has a pharmacy where medical-grade diamorphine is prescribed and dispensed with a sterile safe injecting kit. Patients then take the drug to a booth where they will self-inject under the supervision of a nurse, then move to an aftercare area where they are assessed and their blood and oxygen levels are taken twice to check for signs of overdose before they are allowed to leave. Staff are fully trained in overdose and have access to defibrillators and naloxone, which reverse the effect of an overdose. Those using the service, who must already be involved with the city's homeless addiction team, will attend twice a day for the morning and afternoon sessions. Their dosage will be monitored and if necessary tested for other illegal heroin use to avoid overdose risk. The centre has taken 3 years to be opened after it was one of the recommendations of a public health report in 2016. The centre, then called heroin-assisted treatment, along with a safer drug consumption facility were 2 out of 7 recommendations to tackle the outbreak of HIV among injecting drug users and rising drug death figures that were outstanding. The ideal solution was to locate both facilities on the same site, but legal and political blockages have meant the consumption room has not been given permission. Advice from the Lord Advocate is that the Misuse of Drugs Act 1971 needs amended by Westminster to ensure staff are immune from prosecution and users are not arrested for taking illegal drugs into the centre. The UK Home Office has refused to consider changing the law, so the Council and Health Board through the Health and Social Care Partnership has opened the EDT on its own instead. Dr. Saket Priyardashi, Senior Medical Officer, said the two are quite different. He said, "The EDT deals with relatively small numbers of people. It allows us to help them come off street heroin and onto diamorphine and provide other health needs. There are between 500 and 600 people in the city centre injecting population at risk of HIV and drug. For more on this story, visit the news article link.